Chronic lung disease is a major threat to global health, and COPD is the third leading cause of death in the world. This film explains our research into the causes and prevention of this poorly understood disease. As primary care doctors working in Europe, we've become increasingly aware of the rising tide of chronic lung disease, in particular chronic obstructive pulmonary disease, COPD. So COPD is a condition in which you damage both the air sacs, which causes emphysema, and the airways, which become scarred and narrowed. And the result of this is you get breathlessness, you get tired, and you get fatigued. In Africa, chronic lung disease is a major problem because of the colliding epidemics of tobacco smoke, biomass smoke exposure, tuberculosis, and HIV. All of these things come together to damage the lungs. The scale of the problem is not known in rural Africa, and as a result we did a survey in the Masindi province of northern Uganda. We looked at the results of lung function in 600 adults and the risk factors they had for developing chronic lung disease. In fact, we found that 16% of adults over 30 had COPD, and this is a major cause of concern. Our survey also showed that over 90% of the people in Masindi province of Uganda were exposed to biomass smoke throughout their lives, men averaging 4 hours a day and women 7 hours per day. Biomass fuel is used by half the world's population, particularly in the poorest areas. Biomass includes wood, leaves, grass and charcoal. The smoke from this type of fuel has been associated with many problems, including COPD, lung cancer and chest infections, both in adults and in children. A third of the men in our survey smoked, whereas very few of the women did.
Tobacco smoke is a huge problem in many parts of the world, and while smoking rates in Uganda are relatively low compared to Western countries, they are still an important cause of lung disease. Smoking is characterized by nicotine addiction, and although Uganda has signed up to the WHO Framework Convention for Tobacco Control, there is still a problem in obtaining help for those who wish to quit.
Masindi is a tobacco growing area. The tobacco is cured in huts where children keep a fire burning for days on end. These children get very significant exposures to wood smoke, and the process contributes to deforestation and wood shortages. Kerosene lamps are also a major cause of lung toxicity. The thick black smoke builds up in a hut, but the light is needed to allow the children to do their studying. In Uganda, dusts at work are a serious problem, including grain milling, metal welding, and garage work, and these can lead to exposures to high levels of toxic dusts. For most workers, health and safety measures are not there to protect them. Furthermore, outdoor air pollution is a growing problem caused by burning the bush in the countryside and by traffic in the cities. Chronic lung disease is caused by exposure to tobacco and biomass smoke, which also means that you are likely to get asthma and chest infections, including TB. Multi-resistant TB and HIV add to the problems, and in Africa, people often present late after the TB infection has caused extensive lung damage. As a result, chronic lung diseases are a huge problem. COPD is now the third leading cause of death in the world, causing almost twice as many deaths as HIV. Chronic lung disease creeps up on patients silently, and in the same way, people are not aware of the disease. So doctors, nurses, health planners are very unaware of COPD and chronic lung diseases. This is not the case for heart disease. It's not the case for cancer or diabetes, but chronic lung disease hasn't come across properly yet. After completing the Fresh Air Uganda survey, we met with the project health workers and we discussed, what do we do now? Ultimately, they wanted to help people avoid developing COPD. Therefore, we designed a lung health education program to look at all aspects of prevention of lung disease.
I think it's very important people understand about healthy lungs, and it should be a positive message. So if you want healthy lungs, then we have to change your behavior. And I think the most important thing is that they should be sort of owner of their problem and understand their problem, the awareness, and look for a solution. They have to look for the solution, and we will help them.
We obtained funding from Global Bridges to conduct and evaluate the program. Global Bridges is administered by Harvard University and the Mayo Clinic in America, with resources provided by Pfizer. The main aim of the project was to raise awareness of lung health and how people can protect their lungs, in particular against tobacco smoke and household air pollution. The main causes of lung disease can be addressed by using safer fuels such as charcoal rather than green wood, using more efficient cook stoves, and improving ventilation in the cooking areas. We needed to convey how important it is to keep away from the smoke as much as possible, particularly by the mothers and small children. As a result of this program, in this particular house, a chimney has been installed, making it much safer. Information in the education program also included an explanation of the harmful exposures during pregnancy and childhood, the detrimental effects of smoking tobacco, and issues from asthma and COPD and respiratory infections. The project was run as a train-the-trainer program in a series of phases. In January 2014, we held 14 stakeholder interviews with over 50 people, including expert physicians, the district health officer, the Ministry of Health in Masindi province, and all levels of healthcare workers, including the village healthcare teams. We also had meetings with people in their villages. We asked everybody to look at our initial education materials and the main messages, and each time we received feedback, we improved the materials. We then ran a training workshop for 12 healthcare workers and further refined the materials. These included PowerPoint slides designed in collaboration between the project team and the healthcare workers, and these were printed off as a flip chart and posters.
The material we developed is here. It's going to be used in educating the people. It talks about different ways the lungs get spoiled, and as in the pictures up front here, they are showing different ways of smoke production, cigarette, cooking, dust, and all other kind of production of smoke. So behind the chart, we have some data, some information which can be used to educate the community.
The healthcare workers then went out to the villages in pairs, and they tried them out, and again returned with new ideas to improve the educational materials. These materials then went to the Ministry of Health for professional illustration and have been approved for use throughout Uganda. A further workshop was held where we taught healthcare workers to train people to deliver the program. A further 47 healthcare workers were trained in this way. They in turn delivered the training to 100 village healthcare teams who are now educating the population. In this way, many thousands of people have been made aware of the need to look after their lungs and how to prevent problems in later life. This message was also supported by radio adverts and chat shows.
Upepo afya ni kitu ambao inalekea
roho yako sio ebiwe byawe tibiri birungi nibisobora kuba birwaire.
That is a sign that your lungs are not well and could be under attack.
The materials we have produced are available on the IPCRG website and are free to download. These materials are being used in further projects to raise awareness of the problems of smoke from biomass fuels and tobacco in Africa, Central Asia and the Far East. Research is also being conducted into reducing the exposure to pregnant women and small children, who are very vulnerable to biomass smoke. Chronic lung disease is one of the world's greatest threats, and yet it's almost unknown. In this small project in rural Masindi province, we're showing the way in which this terrible disease can be tackled and prevented.